In communities and homes across America, an epidemic of prescription opioid overdoses is affecting people from virtually every walk of life. Prescription opioids can be addictive and dangerous. Since 1999, the amount of opioids prescribed has quadrupled, and more than 180,000 people have died from prescription opioid overdoses. I'm Deb Howry, the Director of the National Center for Injury Prevention and Control, and here at CDC, our goal is to protect the health and safety of Americans. And one of the greatest health challenges facing our nation today is opioid overdoses. Prescription opioids can pose serious risk to any patient who takes them, and as many as 1 in 4 people who receive them long-term in a primary care setting struggle with opioid addiction. The good news is this epidemic can be stopped by balancing the need to manage patients' chronic pain with the duty to curb dangerous prescribing practices. As a physician myself, with training in emergency medicine and public health, I know that pain management has always been complex and challenging.
At Title, 20 years ago, it became more common to prescribe opioids to treat chronic pain. At Title, at the time, we didn't fully recognize the addictive properties of opioids or their lack of proven effectiveness for treating chronic pain.
Today, we know that the serious and fatal risks of opioids far outweigh their uncertain benefits, and considering safer ways to manage pain is crucial. While there are too many opioids being used for chronic non-cancer pain, there are treatment options that are effective in managing pain with less harm, including exercise and behavioral therapy. Primary care providers prescribe almost half of all opioids, which indicates that they're in the ideal position to combat opioid abuse. Providers report that they're concerned about this abuse, but at the same time, they report insufficient training in prescribing opioids. This is why CDC developed this training for providers who work in primary care settings. The 2016 CDC Guideline for Prescribing Opioids for Chronic Pain focuses on clinical best practices and provides the evidence and guidance you need to ensure that your patients have access to safer, more effective treatments for chronic pain. The 12 recommendations are based on 3 key pillars: determining when to initiate or continue opioids, selecting, dosing, and discontinuing opioids, and assessing and addressing opioid risk and harms. Our promise as physicians is first, do no harm. Following the recommendations in the guideline will help you provide safer and more effective pain management for your patients and ensure patients who struggle with opioid use disorder get the treatment they need, ultimately helping them achieve a better quality of life.
CDC logo appears. At Title, go to www.cdc.gov/drug overdose.